Hello, everyone, and welcome. My name is Janice Chambers. I am the Director of Volunteer Management with Center for Black Equity, and I'm also a master esthetician. And today we're going to bring a panelist of estheticians and a phenomenal plastic surgeon your way to discuss how to take care of skin of color. With me today, I have my wonderful co-host, Ebony Jones Brooks. Where are you, Ebony?
Hey,
Girl, how you doing?
what's going on?
I'm fine. Are you ready to get this going?
Listen, I'm ready to get educated on some things that I don't know, and I'm ready to hear about some things I do know.
Well, we have a panel that's going to definitely give you all the information that you need or things you didn't even think you need. It's so many stories and ways to take care of skin that people have probably never thought about. That's going to definitely blow your mind.
Well, this is right up your alley, so.
Yeah, I like to blow minds. I like to keep the party going, boom. So let's go ahead and get this going. So let's go ahead and start to introduce our list of panelists. First up, we have our esthetician panel group, and we're going to start with Iman Pasha. Where's Iman? Hello, Iman.
Hey.
Iman, I can tell everybody about you, but I think it's best that you introduce yourself.
Okay. Well, I am Iman Pasha. I am a born and bred Washingtonian from Southeast DC. Okay, Ebony. I actually came to aesthetics unconventionally. I used to work in the legal field for about 10, 12 years. I was a criminal defense investigator. Well, that was exciting, but I needed something a little less exciting, a little more subdued. So I kind of transitioned into aesthetics, and now currently I am a licensed master esthetician. I'm a licensed master aesthetics instructor. I actually teach basic aesthetics theory. I teach master aesthetics clinic at a school in Vienna, the Aesthetic Institute. I've been doing that for a while. I'm actually there now. I have some young ladies working on each other in the clinic. I really love it. I have worked in spas, so I will have some things to share there. I've worked for Hand and Stone. I worked for Massage Envy, and up until COVID, I was the regional manager of reservations for Red Door.
Awesome.
Sounds good. Sounds good.
You know the ins and outs from the front and the back.
Yeah.
And private. So you got inside in both ways, and a lot of people need that. So with that said, we're going to introduce our next panelist, and her name
Did she freeze? Okay.
Uh-oh.
I think you froze. You froze when you were saying her name.
I did? I'm still frozen?
Uh-huh. No, you're not frozen now.
You good now.
Okay, so we're just going Trinique to pop in so she can let us know why she's considered as the sextician. Hi, Trinique.
Hey, hi everybody.
How are you?
I'm
I
good.
about you, but I prefer you to introduce yourself.
Okay. Hello, my name is Trinique. I'm the sextician. My boss actually coined that phrase. I'm called the sextician because on top of being an esthetician, I am also a adult sex educator. I teach pleasure positive adult sex education. I got into that because as an esthetician, my specialty is full body waxing. I used to work for European Wax Center, and we deal with a lot of intimate areas of the body. So I would have people, like a lot of my guests come in and they were just so open. They would just talk to me about their love lives, their sex lives, whatever. And that's kind of how I got into sex education. But I became an esthetician because there were, for like a number of reasons, but the main one is just there weren't a lot of estheticians that looked like me. And I just knew that our skin was kind of sort of different and needed more education on it. There was a few Black estheticians that I followed that kind of inspired me into getting into skincare. So here I am, almost 4 years later.
All
Yeah.
right.
Awesome.
Welcome.
Welcome.
I saw that
Every-
title. She had some spelling for it, and I was like, "Oh, wait a minute."
Caught everybody off guard.
Yes, indeed.
Let's bring in our next panelist. We have Miss Aisha Mason. Hi, Aisha.
Hey, Aisha.
How everybody's doing?
How are you?
I'm good. I can't complain.
That's great. As I told everyone else, I can tell everybody about you, but it's best that it comes from you. So can you please introduce yourself?
Yes. Again, I'm Aisha Mason, born and raised in DC. I got into aesthetics because when I was younger, I suffered from a lot of skin disorders like acne, and was very interested in how I could go about clearing it up, and it kind of sent me on this journey that I am on now, where today I'm an esthetician. I've been one for 4 years, experiencing a full service salon and body waxing, and I'm just here to learn and to discuss just my experience being in the industry.
Awesome. So we have another. Welcome. Yes, definitely welcome. Welcome
Thank
to
you.
everyone. So our next panelist we have up is Sharice Dorsey. Welcome, Sharice.
Hi, everybody.
Hey,
Hey.
Sharice.
I'm Sharice. I got into aesthetics actually coming out of my senior year in college. I got really curious because makeup has always been my passion. And what's good makeup without a good foundation? So I kind of got into skin, wanting to learn more about how to better perfect my makeup craft, and then dealing with my own skin concerns of acne. So I was always curious about how to better take care of it. So that's kind of how I got into aesthetics. I'm a master esthetician. I've been an esthetician for about 3 years with my master's, a few months. So I kind of got into it really wanting to up my knowledge on how to better take care of my skin as well as skin of other ethnicities and complexions.
Okay. Awesome. That's great. So welcome everyone, and I'm very, very happy. We're very, very happy to have you, and we're ready to get into this conversation about skin of color. Because as everyone has stated, there are a lot of estheticians out, but there's not that many that look like us.
No.
And our skin is very unique, and you can't just do anything to us. So we're going to go into more detail on how we take care of the melanin that we own.
Yeah.
Period.
All right, well, let's have some fun. Let's get into these questions and let's give our viewers, something to be able to walk away with when they finish looking at this today. You ladies gave us a lot of interesting introductions, and we're ready to roll. So, first question. What are your thoughts on the current social media skincare trends?
Oh, God.
Okay, we gonna go right to me. Well, okay. I actually have this conversation with my students a lot about social media and just being careful what you take from social media. Because any and everybody can get on social media, any and everybody can post whatever they want on social media. There's a lot of stuff out there that's just not true or inaccurate. So I feel like it makes it really hard as an actual practitioner, as an esthetician, as well as an instructor, because you have to kind of wade through all of that and point out what's correct, what's not. Consumers are not that savvy. They're not going to research. They're just into all of the hype. So again, it makes your job really hard, because if everybody is online doing, who knows, at home chemical peels, that was a big thing last year during COVID. at home doing their own chemical peel.
Girl.
The clients think, oh, I go see my esthetician. She does this. It only takes 30 minutes. I can do it too. No, sis. You can't do that. You can be at home learning your skin. But social media makes you think it's that easy.
Yeah.
And so that's my issue with the things that get put on social media. What I feel like is some of the recklessness of some of the practitioners and those who are non-practitioners. There's a lot of unlicensed people on social media posting things. So it really frustrates the industry a lot, in my opinion.
I agree with
Thank you,
that.
Mom.
And I really do blame YouTube for part of that. And
Yes.
YouTube is the reason why people are at home trying to do at-home pills and dermaplaning and all of this stuff. And I tell people stay away from Google and stay away from YouTube.
And TikTok.
Oh yes, TikTok.
Yes. Yes.
That's TikTok.
Yeah.
Okay, anyone else?
Anybody else want to answer?
I would like to add to that. I do feel like there's just too much information, and even with the good information, I believe there's a information overload where you're just taking too much information from different sources, regardless if it's good or not. Because when you have too much, it overwhelms you to where it stifles your decisions. So
Yeah.
I feel as though if you have a concern, don't Google it, don't go to WebMD. Try to find a professional that can level with you and kind of educate you on whatever concerns that you have. That's one. I think if people were more open to reaching out for help than thinking that I could just look this up and I could do it myself, that would be a lot helpful when you do actually come across that professional. So,
Well, you know, part of the reason, right? Part of the reason why people will try to do it themselves is because money.
yeah, they don't think that going to a professional is worth the cost. But when you have a good professional that's able to give you the results when you're abiding by the guidelines that's set by, it could be very it could be worth it. I just think that by us securing our position on social media and fighting against the bad information can help level the playing fields, because you have these influencers who act as if they're estheticians because they're being paid by a company to promote their product.
Right.
And it's just like it could be very frustrating where it's just like, I understand that you may relate to this person for whatever reason, but their intentions are not for you. Their intentions is to make the money.
Right.
The other thing too is I think clients or customers need to be mindful that sometimes cheap comes out expensive.
Yeah.
So you think you get over now and you're doing it the inexpensive way. However, when you give yourself that third degree burn and you don't have that insurance, you're right on my table trying to get me to fix it.
Fix it. Help me.
You should have just spent the money to begin with. I think it's really understated that what you're paying for is not necessarily my service. It's my experience. It's my expertise. It's the fact that I have a license.
Right.
Yeah.
And I want to keep a license. It's insurance in case something happens to you. Going to the influencers or doing it at home yourself, and then something goes wrong, you're not covered for that. Going to the young lady who doesn't have a license and she's all over Instagram, she's teaching classes and she's doing services. When she messages you up, there's no coverage for that. I have a license, I have insurance. So if something goes wrong, which I don't be out here messing people up, something goes wrong, I have an insurance policy, you're covered.
Right.
You know, so I think that clients need to also be mindful in that that's what else you're paying for when you go in and you find out the cost of those services.
I think so. Let me ask you something. When you spoke on the clients and how on social media, you know, we see so much with people that are posting here and they're posting there, and they're saying you can be able to come and get this done for this amount, or this is the experience I had. What is it that you guys do to make that client become comfortable enough that they'll even trust you to use your services anyway?
We tell them the truth.
Right. I was gonna say,
Right.
I'm honest. I'm
Keep
just honest.
it about with them, be honest.
The
Clients
difference
can tell when
between
you're not being honest with them. They can tell when you're being disingenuous. They
Right.
smell that a mile away.
Right.
not
Honestly,
only
it's
that, the difference between a random person giving out advice and professionalism, we have protocols that we have to follow. So if anything does go wrong, we already have that knowledge as to how to solve it versus someone who's just working out of their home, who doesn't have a license, can actually cause you permanent damage and then
Right.
not even know how to rectify it because they don't know the protocols.
I think
Exactly.
So
I think
yeah,
some
guys.
people, the problem with social media is social media creates a false reality of perfection.
Yes.
So people are thinking, oh, it should be perfect. This is how it should be. It's like no, people are confusing status with credentials. Oh, it's completely different. But don't get me wrong, people confuse credentials with skill. You can have all the credentials in the world and have no skill. So,
Yeah.
of course, I want to see your work. I want no reviews. Of course, you'd be reluctant to go to someone that has no reviews or no skill or not posting things like that. Because now today in today's age, social media for your business more than likely is going to be your friend. But how you go about that makes a huge difference. You have to segue through all of the nonsense and foolishness that people are putting out here because they're like, oh, well, this person puts this up, I should try it. And it's like we talked about chemical pills. That's been such a big fad, but you don't know that there's steps to this chemical pill. You're just diving head first and you don't know how to swim.
But I'm
That's
big
not
on
how
reviews. So when you
Yes.
said that, a lot of people,
The
they want to see
ordinary
reviews.
face
I want
pill
to
comes to
see,
mind.
show me a before and an after, but a
Right,
real
exactly.
before and an after. Not
Right.
one
People
that
are
you
doing videos
found.
nowadays. So
Right.
videos, people are recording their services while they're doing it, or they're doing before and afters, things like that. It's like I want to be able to see your work, or I want to, someone that I truly trust that's going to recommend you or word of mouth, and not like, oh, well, on social media you do this, you do that. I've had a client come in second degree burn her skin. Oh, I want to fix this. I said, no, ma'am. You need to let this heal before you even think about wanting to fix this, because this girl that this was going to work for me. Now your whole body looks crazy because you wanted to follow behind Susie and everyone else. No, that's not how that works.
Okay, so while you tap on chemical pills, Sharice, let's go ahead and just ask the question. Do you prefer chemical pills or plant-based pills or products?
Mhm.
I like both because I feel like each particular product serves its purpose. It serves its purpose, and for which stage you are in your skincare journey, the type of skin that you have, what your skin can and can't tolerate. So to me, I really pride myself when it comes to my clients, educating them on things, because people will come and say, oh, I want all natural, I want organic. You don't even know the difference. So let me just school you, sis, okay?
Right.
Because I want that driven off of what they read on social media, what they read out of books and things like that, and not knowing the difference. So educating your client is the number one priority about what will be best for your skin in the time frame of what's going on with your skin. I'll have clients come in all the time. Okay, well, what are we doing for our next treatment? And I'll let them know it's not what are we doing next time. What can your skin handle the next time, or what's going on with your skin the next time you come in? How your skin is reacting right now and what your skin is going through right now, your skin may or may not be able to take, because you could have did something else. You may not have been patient enough to wait for your next service. Oh, this new product drop, I'm going to try it. Then you come back to me. I'm like, what's going on with your skin? Well, it's just, I just had a little reaction. No, you didn't. You lying. Because I know you did something. So it's like, what's going on with your clients. Like, I always tell my clients, be honest with me. It's no need for you to lie, because if you lie, you tell me the truth.
Right. So people with sensitive skin should definitely let you guys know that
Definitely.
hey, I have sensitive skin.
Right.
I can't use certain products, X, Y, Z, and then that helps you better to know what products you should and shouldn't use with those clients.
Absolutely.
Right. Exactly.
Makes sense.
They love to lie.
Hey. So when it comes to the grooming, right? Oh, well, see, we have questions coming in, but we'll answer some of those questions shortly from our viewers. because they have questions already. When it comes to grooming, do you prefer waxing or shaving?
Waxing.
Waxing.
Wax.
Period.
Once you wax, you will not go back. I'm telling you. That's
I'm
it.
shaving. I'm gonna stick to the shave.
All you gotta do is just ask their partner, do you prefer waxing or shaving? They're gonna say wax.
Wax.
Tell us why. Why do you prefer
Yeah.
waxing over shaving?
Me?
Yes,
Anybody,
esthetician.
all of them.
Well, let me just tell you. For me as a Black woman, shaving, first of all, let's just talk about how ghetto shaving is. Shaving is trash, right? It causes
Now,
all type of
hold
hyperpigmentation.
on,
That's
sexy
discoloration for people who don't know. Like, nobody want a black vagina. That's not cute. We have this kinky curly hair that's prone. We're really prone to ingrowns. Waxing eliminates all of that. Gets it from the root. It come back thinner and softer. It takes forever to come back. Like, you don't gotta shave every 2 days. Like, waxing is just better all
All
So how
around.
often would you get waxed? If you're waxing,
I
it
suggest
doesn't
once
come
a
back
month.
the same.
Once a month, you would need to get
Wow.
waxed. You want everything to be on the same growth cycle. Like,
Mhm.
waxing is just that
It
girl.
depends on the part of your body. Each part of the body grows at a different rate. And then also depends on your genetics as well. You'll have some
Right.
clients who are naturally hairy that grows back hair a lot faster than others. So
Right.
take that into consideration as well.
The
You just
weather
answered that
determines that
question.
too.
Okay, so I'm gonna ask this question because one of our viewers actually posted it. So the question is, what is your brand and what sets you apart from other estheticians?
It's a good question.
That's a good question.
I'll answer that first.
Okay.
As far as my brand, I feel like so many people are quick to say, "Oh, this is my brand. This is my brand." Right now, I'm in the midst of creating my brand. So for me, I feel like it's important that what I put out, I can put my name on and live by it, and not just like, "Oh yeah, I'm an esthetician. Come see me. This is what I do." And then they're like, "But what is your brand? Being an esthetician is not your brand. Like, what defines you?" And I feel like I'm still in the process of learning that about myself and my brand and what I want to be able to put out, because anybody can say they're an esthetician, but what do you provide that's different from everybody else? So for me, that's something that I'm still working on to develop for myself.
Okay.
That's honest.
So, but what sets you apart from other estheticians? Answer that part.
What sets me apart is my honesty, the level of knowledge that I give to my clients, and I'm constantly learning as my clients are learning. So me being able to provide new information, like if I don't know something with my clients, I'll say, I'll exchange information with them, update with them, give them new information, especially when clients ask me about new trending treatments or products on the market that I may or may not even know about. So I'll make sure that I constantly am educating them about things going on with their skin, products, treatments, and things like that. And just an experience. I know the type of experience that I provide to my clients that they're not going to want to go anywhere else unless I recommend it.
Okay. Aisha, what about you?
Well, I feel like my brand, or what's part of my brand, is integrity. Whatever it is that I'm setting forth to my client, I wholeheartedly believe in. I don't think that it's okay to purposely misguide your client. What sets me apart, again, reinforces my brand of the integrity of making sure that my client is at least have some understanding of what what services I provide, what type of results they should expect with the procedures that I do, and just to emphasize the aftercare once they leave me, and I have no control over what it is that they what it is that they do. So I think just operating on that end sets me apart, because there are a lot of estheticians, but there are few estheticians that really work under the guise of being honest and putting forth good information that the client could truly take away.
Thank you, Aisha. So let me ask you this. Speaking of clients and being able to give them all the services that they need. What are some red flags when you're looking for a skin professional?
Red
Hygiene.
flags for a skin professional. I think some red flags if they don't make their license available to know that they are actually current and up to date. If they have a website and they don't really emphasize any policies as far as what will not make the client a good candidate to come in and get services. If you're not making your client aware that they may not be eligible for certain services because of contraindications, whatever that case may be. If you don't have a policy as to how your scheduling works, as far as like booking or canceling appointments, I think as a good esthetician, you should have fundamental basics as far as how you should go about providing services for your client, because it's not just about the products or what it is that you're providing. It's also before they even come to you, the work should have already been started, so that they can be aware that they coming in, they have expectations to come and get waxed, but then they got sunburn on their legs. Well, you need to inform them they can't come in and get that done until their skin is in good standing to get it done. So I feel like if the esthetician is not stressing those certain things, then those are red flags of not a professional.
By you saying that, Aisha, that puts me to my next question. Sunscreen, yay or nay?
Yay.
Yay.
Including Black folks. Yay.
Yes. My melanated people.
Black don't crack.
Yes.
Black don't crack.
Black don't crack.
I've been personally told
It don't crack its fast, but it will crack.
I don't need sunscreen. I find that weird. So I'm like, no one is sunproof.
Hey.
So everybody agrees there's a yay on sunscreen.
Yeah.
Yay on sunscreen.
Okay. All right, Ebony, what were you saying?
Actually, I just wanted to know, because we were talking about red flags. What are some reasons that will cause you to maybe turn a client away? I know we talked about waxing and shaving. And
medication.
I know, some people, are not always so fresh and so clean, and then they come to you. I mean, look, I just be honest. What is that you guys do? How do you communicate to that client that you may have to turn them away? And it's not necessarily just because they might not be fresh, but how do you say that to your client? I mean,
before you answer that, you have to elaborate on what do you mean by so fresh, so clean.
Yeah.
If you come into the room and they remove their garments and you getting ready to do the wax, and when you get there, the kind of make you jump back a little bit. Those kind. If you make you do that, I want to know. Like in that
There's
moment,
a bathroom down the hall.
Life? Are you rethinking your life? Like, I don't know.
I definitely rethink my life in that moment. Like, I really chose to be a waxer at this moment, but because that's happened to me a few times. Again, working with the company, it's a little bit harder, but I guess like Sharice said, there's a bathroom down the hall. Do you want to clean yourself up before we get started? I wish they took that advice more often. That's all I got to say about that.
Yeah, and I think Miss Janice said it in just saying that when you work for yourself versus when you work for someone else, you know what you will and will not tolerate.
Exactly.
Policies set into play. Like for me, even though I worked at European Wax Center as well, I worked at 2 separate locations, so 2 different things was provided. At one of my locations, we had wipes. Every client that came, there's vaginal wipes front to back. And yes, I've had a client say, "Oh, you don't do that, no, ma'am. I'm not wiping you. You wrong."
Okay, so I got. Let me ask this question because we just got a question from the audience again.
That's one of my students.
Is it rude to ask your client to freshen up before their service?
When it's your
It's
company,
not.
no.
Yes.
No. And I'm not even an esthetician, and I'm saying no, it's not.
It's how you word it.
It's how you word it.
Yes,
Yeah.
how you word is important. If you say, "Oh, you need to freshen
Yeah.
up," that sounds rude.
Now, if it's one of my regulars, girl,
Wow.
It's not as formal.
But what about on paper? You know, I know sometimes with some companies they'll have you come in, like you go to a tattoo shop. When you go to that tattoo shop, you have to fill out some information, and then it's like waivers or things that are telling you exactly how things are going to take place. Is it somewhere in there in your paperwork that they may be filling out that it can,
They don't read.
kind of in advance? When you send them reminders for their appointment, it might say, please make sure that, all hygiene needs are, taken care of prior to arrival. I mean,
Clients
is
set
that
themselves
okay?
Clients set themselves up because they don't read. So it's like you have to reiterate even when they come in because they
Yeah.
don't read. It's like, oh, well, it clearly says stop using this product before this amount of time, or don't do this, or don't do that, and they do it anyway. So it's like we're not going to do this service, or we're going to do it with modifications, and you can't be mad at the results that you receive because you didn't follow
Right.
instructions.
True.
I mean, clearly
Right.
reading is not fundamental for everyone.
I'm gonna just say something. I'm gonna switch us off for wax for a minute, because every once in a while you have to break up with a skincare client too. And I've had some where I've had to just end the relationship because the level of commitment wasn't there.
yeah.
And at some point, I have to be honest with you and say, you basically just coming in here throwing money at me for no reason because you're inconsistent with your appointments. You're not following proper home care. It might be time that you go see a doctor or somebody who can get you on something that's more in line with your schedule. Maybe you need something, a medication, something that's less of a commitment than what we're doing here, because I'm 20% of what you're getting out of this. You're the 80. And if you're not doing your part, we're not getting anywhere.
Yeah.
You know what?
You have to be honest with them about that.
Right.
Yeah.
By you making that statement and tapping into that actually goes into the question that we have coming up now from one of our viewers. And the question is, how do you get rid of acne scars?
Commitment. Number one.
No, honestly, I mean, there are any number of ways to get rid of acne scars. It would really depend on the significance or severity of the scar, what we're talking about. Is it, okay, to get technical, how we know, is it PIH? Is it like post-inflammatory hyperpigmentation? But to those of you out there, like, that means dark spots. Is it like dark spots? Is it an actual acne scar, like something that's raised that I can feel? Is it pitted? Like, is there like a pit or a hole or something like in your skin? The pores are more enlarged. And it would really depend on what we were talking about. And there any different level of things that could be done, from regular routine home care to peels to microneedling, all the way up to like laser resurfacings. It just really depends on what you were dealing with.
It's very
You
patient.
ladies have been extremely informative. You have given us, I know you've given me a lot more than I knew before I got on here, especially Miss Sextitian over here. I got, we're going to talk offline. Find out some things. No, but seriously, how can any clients that may be watching, our viewers, how can they get in contact with you guys if they're interested in your services? We have options, so how can they reach you?
First, I'm always on Instagram all the time. My Instagram name is the.sextitian. So you can reach me on there. My links and everything are on there. I have some things coming up that I need to talk to you about, Miss Janice. But anyways, I have some things coming up. Like, I want to, a wax training course. I'm really passionate about waxing, and I'm really passionate about teaching. So I kind of want to merge the two. So I have some things coming up, and my link is in my bio on my Instagram, but I'm always on Instagram. So if you want to reach out to me, ask me questions, whatever, I follow back, whatever. The.sextitian.
All right.
Anyone else want to share their contact?
Anybody else?
I'm also on Instagram as well. My business Instagram is Royal Reflections Aesthetics, and that's reflections with an S and aesthetics with an S.
Okay.
All right. I am on Instagram at Skynergy, which is SKYNERGY by Iman Iman. And that's my Instagram. I am on Facebook at Iman Pasha. I'm an educator, so I'm teaching at the Aesthetic Institute. You can usually find me there most days. I'm there like every day of the week, except Friday. So
Like today.
Yeah, like today. So those are the easiest ways to get in touch with me.
Okay.
Okay, Miss Aisha.
Kind of being put on the spot. My Instagram page is not up, so at this time, I don't have anything for the clients to contact me with.
Okay.
Not
Okay,
at this
well,
moment.
we
Well, no
definitely
problem.
thank you, ladies.
Thank you guys.
We had a great time with you.
Thank
I
you
hope
for
we can do
coming
this
in.
again.
Yes, this was fun. I like
Yes,
it.
I enjoyed
I
it.
really enjoyed
Well, we're
it.
glad you enjoyed. We would love to have you guys back sometime soon or in the near future. So thank you. We appreciate you and keep on estheticianing.
I don't think that's a word, but okay.
We do Ebonics around here. You know, look, you said you from DC now.
I am
Come on
from
now.
Southeast.
All right.
From off of Good Hope
All
Road.
right.
Come on.
Okay, so next, thank you again, ladies. So next up, we have a commercial break coming, but we have Dr. Kelly Bowden, plastic surgeon, coming up. And that means we're going to get really in more depth with skin of color. So sit back, give us a few seconds, enjoy this commercial break, and we'll see you in a minute.
Pride is a moment. Pride is a promise. Pride is a journey. Pride is an awakening. Pride is the love we share. Pride is universal. Just say Pride into your Xfinity voice remote to celebrate Pride all year long. With Xfinity, it's Pride all year.
Welcome back. Was it long enough for you, Abney?
I think so. Yeah, I got a couple sips of water and stuff, and you know,
I got a couple sips of spit.
yeah. You just need it. Look, bathroom break, maybe no.
Okay, so let's keep the ball rolling. Oh God, this is such a treat for everybody. If you do not know, Dr. Kelly Bowden is everything. She's everything, and I can't wait to put her up. So let's introduce her, Miss Kelly Bowden.
Hi, how is everybody?
Hello,
Dr.
Bowden. How are you?
Good. Well, great to see everybody. Thank you, Janice, so much for including me.
Thank you.
This is always a treat. Yeah, it's always a treat. Just for those of you out there that probably don't know who I am, I'm Kelly Bowden. I'm a plastic surgeon here in Washington, D.C., or in the DMV. My primary practice is actually at Cultura Dermatology and Plastic Surgery, which is in Friendship Heights in Washington, D.C. But I also am an assistant professor at Howard. So I do most of my reconstructive practice at Howard. That includes breast reconstruction for cancer. I do top surgery in transgender patients. And then I do a lot of body contouring post-major weight loss at Howard. And then my practice at Cultura is exclusively cosmetic, with the emphasis being on skin of color. All of our patients aren't skin of color, but we have, the title of the company, the owner of the company, who I'm partnered with, Dr. Elliot Battle, is known for his expertise in skin of color, particularly with lasers. And so when he brought me in, that was just a part of the practice, was that we wanted to make sure that we provided expertise in skin of color because we heal differently. We react differently to different products. I heard you all on here earlier talking about chemical peels, and it scares me to death to hear that people are doing stuff like that at home without supervision, because we just heal differently, we scar differently. And so I think it's important, even if you can't find a physician of color or a surgeon of color, to at least have someone who's got that experience. So I'm excited to be here and share what information I can to help you all make informed decisions. So yeah, I'll let you guys take it from here.
You have me blushing on the inside and outside. Because this is just so awesome to have you here. So let's just go into our first question.
Sure.
Can you give us tips on choosing a plastic surgeon?
Oh gosh, absolutely. So first things first, when you're choosing a plastic surgeon, it seems like, people say what's in a name, and that part is so critical. If you really, really pay attention, you can only call yourself a plastic surgeon if you've had training in plastic and reconstructive surgery. Most of us have either done 5 years of general surgery training and then gone on to do what we call a fellowship, which is additional training in plastic surgery, or some of us do plastic surgery training straight out of medical school. But we're all medical, go to medical school. We're all physicians. We're all MDs, but our board certification is in plastic surgery, which means we spend anywhere between 6 and 8 years doing just plastic surgery. That's different from someone who calls themselves a cosmetic surgeon. Anyone can call themselves a cosmetic surgeon. That was something that's unfortunate that as plastic surgeons, our society didn't quite get a hold of. And so unfortunately for the consumer, a lot of people will mistakenly think that someone who calls himself a cosmetic surgeon is indeed a plastic surgeon, and that's not true. Now, the reverse is true. Plastic surgeons are cosmetic surgeons, but cosmetic surgeons aren't always plastic surgeons. So your first question actually should say, can you please tell me what your board certification is? Because you might find that they'll say I'm board certified, but they won't tell you in what. And it may be a board certified gastroenterologist who is telling you they can do liposuction. It may be a board certified, internal medicine doctor, a board certified gynecologist, and they have expertise of their own, but they have not received training in plastic surgery. You have dermatologists that sometimes will refer themselves as cosmetic surgeons, and that's not really, they're not plastic surgeons. So that's going to be your first question is, are you board certified? And tell me what your board certification is in. The second thing I think is just making sure that you do your personal research. The wonderful thing about my practice, and this is why I love doing things like this and why I would do anything that Janice asked me to do, is because, you make relationships, and, you have people that'll be able to put your name around and say, okay, this is a person that I trust, or this is someone you should go to. So you can learn a lot on the street. I mean, I'm sure that's the same thing, within the aesthetics world, period, or just with any industry. You can learn a lot on the street. So I think just asking questions. Who do you go to? Who do you know that other people go to? Have they had a lot of complications? What have you heard? And at least get your research and your information done. And then I think the third thing is just do visits. We offer complimentary consultations in my practice. A lot of surgeons do. Even if it's not complimentary, a lot of times they'll give you credit toward a procedure if you do that. But I think there's something to be said about actually talking to that physician, because you'll get a vibe. And I think it's a relationship. I always tell people it's like going on a date. Sometimes you go on a date and you just don't feel that vibe. That's not the one for you. So I think getting to meet that person, and it can be virtually, because, in this day and age, a lot of that's how we communicate now is with virtual things. So virtual consultations are fine as well. I do them all the time. But just getting on the phone or in person and just really meeting with that surgeon. I think those are probably the biggest things with that main thing. And it sounds like you're being nitpicky, but you've got to ask and make sure it's a board certified plastic surgeon.
Okay, that's great to know.
Yeah.
So my next question is this. Everybody has jumped on the BBL craze. Everybody wants a Brazilian butt lift. Can you please tell our viewers who can and who cannot actually get this BBL? And if they can get it, how do they maintain it?
If they're able to, okay. So, and most people know what a BBL is, but BBL stands for Brazilian butt lift. And that's sort of the, I guess, I won't call it the commercial name, but that's kind of the I guess, what do you call it? Not layman's terms. I don't know what the word is, but BBL stands for Brazilian butt lift. But what that really means is that you're transferring fat to your butt that comes from some other part of your body. Most people probably take it from around the trunk, doing what we call lipo 360. Some people take it from the inner thighs, the arms. It's really just anywhere that you have fat to spare. That fat is harvested, or we suck it out with a cannula, just like when we do liposuction. We prepare the fat and then we re-inject it into the butt. So who are candidates for BBL? Well, one, you have to have enough fat to use to move somewhere else. And it doesn't mean that you have to be fat. It just means that you have to have some fat stored somewhere that we can harvest. Most people carry a little bit of fat on their abdominal wall. A lot of people carry fat in the flank area, which is on your back. And a lot of people carry fat on their inner thighs. So more people are candidates than they realize, with the caveat that, as long as you're not trying to get a butt that's, 3 times the size of your current butt, then I think there's reasonable candidates out there for everybody. When you do a BBL, one of the things I think a lot of people don't explain is, and I also was referring about or listening to y'all's question about social media, and social media can be harmful because it's great and it's harmful, but social media can also give you kind of a blurred perspective when it comes to BBLs, because you've got people like celebrities like the Kardashians, Nicki Minaj, Saweetie. I mean, a lot of different celebrities that have had BBLs, and sometimes people will think it's a one-shot deal. Okay, well, they went in, they did it, now they look great. And if you really pay attention, a lot of those celebrities have evolved over time, which means that they probably had more than one surgery, meaning that they've had more than one session to get that fat transferred. And that's okay if that's what your end goal is, but it just depends on what you're looking for. So as long as you have some fat that you can take, then you're a candidate for BBL. And then also, depending on how big or what the desired outcome that you're looking for is, that's going to dictate, one, how many procedures you need to have. And to Janice's point, she's asking, how do you maintain it? Because the reality is we transfer the fat, but the fat is a graft. And for those of you that are familiar with how grafts work, you basically take a body part, or it's typically skin, fat, something like that. You disrupt it from where it's supposed to be and put it somewhere else. It's got to actually grow blood supply and become a part of your body. And so the fat that we transfer, we know that only about 50 to 60% of that fat is going to quote unquote take, meaning that it's going to stay behind. So a lot of times we have to over treat because we know that some of that fat is going to resorb over time in the butt that you have coming off the table, or you can transfer fat to your breast, you can transfer fat to your face. So anywhere we transfer that fat, we know that how you look on the table is one thing, but then at about, after you've healed about 6 months, not 6 months, about 6 to 8 weeks later, you'll only have about 50 to 60% of that fat that's still there. So maintaining it is really just kind of making sure you do appropriate post-operative care. There's not a real consensus as to what works. We don't, I think BBLs are new enough in plastic surgery that we don't really have good, consistent post-operative management. I know some surgeons that let you sit on your butt right away. Probably the majority of surgeons will tell you not to sit on your butt for about 6 weeks. I tell my patients to give me 2 weeks because I'm basing that just on what I know about grafts, like skin grafts and things like that. And it takes about a week or two for that tissue to grow new blood supply. So you want to at least follow your doctor's instructions, because each surgeon is going to have their own technique, and their technique has been perfected in their hands, just like with all of the estheticians that were on the call earlier as well. We may use different techniques, but when you do it over and over and you gain an expertise, your results are based on you kind of doing your thing. So if, just because I say 2 weeks doesn't mean that my outcome is necessarily any better than the doctor that says 6 weeks. It's just that in their hands, that's how it works. So the best way to maintain it is following their instructions that they give you post-operatively. You definitely want to always make sure you have a good garment, because controlling swelling and things like that always make a big difference as well. Some people will do lymphatic massage just to help with, drainage and things like that. And I think that's very useful. So those are the things that I think are good in maintaining your results as much as possible. And then probably the biggest thing, and this is not just for BBLs, but this is for any plastic surgery in particular, maintaining your weight. A lot of times people will come in and either do plastic surgery as a weight loss mechanism, and it's not that. I think if you're trying to do plastic surgery for weight loss, you're making the wrong decision. Or they get plastic surgery and then kind of abandon all of their diet and exercise and eating habits, and they either gain a lot of weight, or some people go overboard and lose a lot of weight. That fat, once it's in there, that becomes your fat, and it functions just like any other fat. So excessive weight gain, fat's probably going to get bigger, and it's going to grow in places where you have fat that you didn't have before. If you have a lot of weight loss, that fat's going to also shrink or atrophy, and that may also affect your results. So the best way to maintain any results in plastic surgery is just to maintain at least a steady weight. Doesn't have to be 1 pound. I think everybody fluctuates probably between a 5 and 10 pound, boundary. But generally speaking, you just want to try to maintain your weight as best as possible.
That was an awesome answer.
Well, now you done had all of these procedures done. We done did the BBL. We had the plastic surgery here. Now, how do you keep your youth? Because, after you had all these procedures done on your body, now I want to match what I just got done. So how do we keep that youthful look going that we already have? I have.
So, what you do, I think you have very, very, very youthful. So I think probably, and it's one of my favorite things to say, even though I know it's not true. You know, people always walk around and talk about black don't crack or all that kind of things. And to an extent, it's true. You know, the more melanin you have and things like that, you tend to have more elasticity in your skin, and that helps you to stay youthful longer. So a lot of people, or a lot of skin of color patients, do maintain their youth a little bit longer. But generally speaking, we all start showing signs of aging, even though we don't realize it. We start showing signs of aging as early as our 30s. And what really happens is it's just our fat compartments in our face, the fat starts to atrophy or shrink a bit, and sometimes it can start to descend. And so sometimes you'll look in the, people will tell you they look in the mirror and all of a sudden one day they just feel like their face kind of fell, or they look really hollow, or they look really haggard. And that's just because over time that fat just it shrinks a little bit and it descends. So really, if you're trying to maintain that youthful look, you want to get on a good skincare regimen as young, I think once you hit puberty, really, we should probably start thinking about a good skincare regimen. So getting a good skincare regimen, and then the maintenance piece, even though I know people hate to think it, sometimes it starts when you're in your 30s. It may be that you're getting, if you when you animate, you get a lot of deep wrinkles in your forehead. That means when you're making facial expressions, if you get a lot of wrinkles, or it gets to the point where your wrinkles don't go away when you're not smiling or frowning or excited, it may be time to get a little Botox, and actually, which is a neurotoxin that paralyzes the muscles and kind of eliminate that risk of getting really, really big wrinkles. Some patients might do a little bit of filler to kind of restore the contour of their cheeks, or, if your chin is a little recessive. So there's a lot of things that you can do without going over the top to do good maintenance. And I think if the key is if you start it early and just very subtle changes, I think that's the best way to keep your look youthful. The problem is a lot of times we wait, and especially in communities of color, we tend to wait until we, hit 50 or 60. And at that point, it's like and then the common thing I hear all the time is I woke up and all of a sudden I looked in the mirror and I didn't recognize myself, because we let everything go so far that now we're talking about major changes, and, you're doing surgical procedures to try to get rid of loose skin and all those kind of things. When really, if you start doing that early and doing maintenance, good skincare regimen, there are lasers for complexion blending and things like that, doing Botox or maybe a little bit of filler. You can use your own fat to restore volume to your face. Those are things that I think starting in your 30s and 40s are reasonable, particularly if you'd like to do maintenance. Peels in the right hands, I think, are excellent because it helps, regenerate and do skin turnover, all those kind of things. So I think the key to maintaining a youthful look is to start early and just do little teeny things the whole time. And I think that's when you see the best results.
So when would you think that the best time would be for a person to find a dermatologist? When they begin to deal with different things going on with their skin after they've had, these procedures and things done.
So I think if, particularly if you're a teenager and you struggled with acne and things like that, of course, I think you need to seek a dermatologist in your teenage years for sure. But there are a lot of people that don't, their skin they have great skin. I mean, my mom sometimes it's so frustrating because, my mom has beautiful skin, and people would say, well, what's your skincare regimen? And she'd be like, oh, I just use soap and water and then put a little Vaseline on, like something like that. And you're like, okay, but that's one in 1,000 people who gets to do that. But a lot of people don't require really intense skincare regimens early on, or at least they don't think they require it. But when they get on one, it's amazing. You can see the difference. Your skin takes on a different texture, a different tone. It's more, your complexion is more even. So I think finding a dermatologist, even if it's not a dermatologist for medical treatment, just even for that aesthetic or that cosmetic aspect, I think that's a reasonable thing to do in your 20s or 30s as well, because there's just little things that you may not realize. It took me turning 40 before I actually saw it. I mean, and I'm in the field, I'm a plastic surgeon, but it took me until I was 40 to really think about skincare. And I started using, a very, very light tretinoin with my daily skincare routine. It changed the way that my skin looks. It changed how bright my complexion is and things like that. So now I'm more conscientious myself of skincare, and I think it definitely helps. So I think if you're not sure, if you're concerned in any way, go see a dermatologist. a lot of dermatologists will do your consultation, and they have estheticians that help you along the way. So it's a really nice balance. A lot of dermatology practices will have, an MD that's a dermatologist. They'll have a few nurses or nurse practitioners that'll do procedures like injectables and the like. And then they have estheticians that'll help you with your routine skin maintenance. So I think finding a practice that has all of those combined is probably best, just because you can get everything done in the same setting and under the same roof.
Okay. By you answering those two questions, youthful look and when to find a dermatologist, because you can actually blend the two, dermatologist, plastic surgeon, giving you the look that you want. What other procedures would you suggest if someone had like saggy jaws or needed something tight outside of getting the facelift?
Okay, so because I was going to say the gold, and I like the way you phrase it. You said outside of a facelift, because that's true. A lot of people do not want to go the facelift neck lift route. Now, that is the gold standard, just because we're able to affect the extra skin. We can address the muscle, we can address the fat, all in one procedure. The downside is, of course, the scars that are associated with it, because then you've got scars around your ears and the back behind your ears and the hairline. So sometimes it comes to that, but generally speaking, we try to do other procedures that are less invasive. So we talked about Botox or other neurotoxins, and by neurotoxin, I mean that would be like your Botoxes, your Jeuveaus, your Dysports, things like that. And again, those are what paralyze the muscles. You can have some improvement of things by doing Botox, and that in an expert hands, you can do a lot with Botox that people don't think about. Most people think about Botox, I'm going to get rid of my forehead wrinkles, or Botox, I'm going to get rid of my crow's feet. But they don't realize that with Botox, you can also do some things like what we call a chemical brow lift. So by paralyzing certain muscles, you make other muscles activate. And so you can actually do a little brow lift by paralyzing the muscles below the brow to make the brow raise up. For the jowl area, a lot of times people will start to notice that their mouth starts to turn down like this. By paralyzing the muscles here, we can actually turn the mouth up, which can in some respects help to lift the jowls up as well. Other things that you can do are fillers. You restore the volume back here, you're going to get a lift on the face, and you can see every time I do that, I'm pulling up, just even though I'm putting volume here, I'm going to get some improvement along the jawline as well. So those are the procedures that you can do for that. But other procedures that are a little bit more invasive would be things like radio frequency. In my practice, we use what's called Body Tight, Face Tight, AccuTite. It's a radio frequency system where we put a little probe under the skin and another probe goes on top of the skin. And what's happened is you get radio frequency treatment in between. It heats the tissues. The purpose is to get those collagen fibers to kind of contract and shrink so that you get skin tightening. Other similar modalities to that would be like J-plasma, Renuvion, all those kind of things. So I think those would be, the next tier of treatment after Botox and fillers or fat transfer or some sort of filling agent. The next tier of treatment would be to try to do some sort of radio frequency or skin tightening procedure, but understanding that that has its limitations as well. So if you're already to the point where you've got that kind of thin, almost crepe paper like skin, or if it's really sagging quite a bit, whether it's on your neck or whether it's on the jowl area or around the face, sometimes a facelift or a neck lift is inevitable. But again, if you start it early, then usually you can try to keep your skin tone up and things like that, and that'll really help. But I would say Botox and fillers is first, just to restore volume, to kind of eliminate some of the wrinkles, or to provide what I would call counter animations so that you can do your brow lifts or things like that. And then the next tier would be doing something like a radio frequency or a skin tightening type procedure. Sorry, one other thing that you can do, and I don't offer it in my practice, but there are people that do it, are threads, which are PDO threads. And those are little threads. It's semi-invasive as well. You can put threads down and it actually will lift on the tissues. All of those treatments, Botox, fillers, PDO threads, give you anywhere between 8 to 24 months, depending on what product you use. So it's something that you have to maintain. And I think that's an important thing for people to keep in mind. A lot of times people think, well, I'm going to go get this procedure done and that's it. It's just like anything else. You've got to maintain. So even though you're going to get it done, this week, it may be in another 12 months, you got to go and repeat it, or another 18 months, you got to go and repeat it. It's just like anything else. You're not able to just kind of do a procedure and you're there for life. You've got to continue to do maintenance for the whole time, but it's worth it. It's an investment.
So what about creams? Sometimes we see those commercials where they have the cream under here and it takes away the wrinkles and it helps to tighten the face. Are those creams really effective, or is it just the
I,
whole social media trend, like we said, it's a gimmick?
Yeah, I think I know you're talking about the ones where they say, "Oh, you don't need to do a neck lift, use this cream," and then they show the grandfather and yeah.
Yeah.
So I don't know if any of you all have ever tried those. I actually, because when you walk down the street sometimes, or if you're in a mall, people will stop you to do it. So I actually had them do it one time on you, and it's almost like they're putting a cast on your face. It's not really, it's very temporary. Once it comes off, it goes away, but it's almost like they're just putting a cast. So what they do is they put it on and it kind of makes your skin do this, and then but there's like a film on your face. So there's no treatment. So that was a long way to say no. There's no cream. There's no one cream that will automatically instantly take years off of you. There are several skincare products. Again, I mentioned about tretinoins, people talk about Retin-A, things like that. Having a Retin-A in your regimen, using a vitamin C, a vitamin E, all of those types of things used over time absolutely will help improve your skin. But there is not a single product out there that you can put on that's going to all of a sudden take away those wrinkles and that laxity. That's one thing about skin that we cannot reverse. We can't, once you've kind of gotten that laxity, and some of you on there may think about it after pregnancy, when you get that loose skin on your belly and the stretch marks and all those kind of things. Unfortunately, there's just nothing that you can do to reverse those effects other than to either remove it or try to camouflage it somehow with garments and things like that. So it's the same thing for skin on your face. Once it starts to sag, it's really hard to tighten it back up unless you've still got some elasticity left. And in those cases, that's when people are good candidates for things like the radiofrequency.
By you saying that about women who get lax skin on their stomach, around their abdomen after they have a baby, would you advise them to get a tummy tuck?
I would. So I see, and that's probably, that's probably in the top 3 of people that I see. I see a lot of women that come in post-pregnancy and they've got a lot of stretch marks, they've got skin laxity, and they're either asking for something less invasive like a body tight, or they just want to do liposuction. Again, once you start seeing stretch marks, all stretch marks is it just means that those collagen fibers that provide that elasticity in your skin, they're fractured. So that's why that skin won't tighten up. So unfortunately, you can go to the gym. I mean, you can work out until you're blue in the face. That skin laxity is not going to recover. And what a lot of people find out, men, women, whoever, especially like if this can happen with pregnancy, it can happen with major weight loss. Once that skin has lost its elasticity, the more weight you lose, the looser the skin actually gets. So by losing more weight or by trying to do liposuction, you're going to deflate the tissues, but you're not going to tighten the tissues. The only way to tighten tissues is to really actually take that skin out somehow. So that's why a tummy tuck is really the only option for someone. If you've got a lot of stretch marks or a lot of loose skin around the abdomen, you're just not going to get a great result unless you take that skin out. And that's important to know and to really think about, because there's a lot of marketing out there. There's some companies that market that they can get you these great results, but all they're doing is liposuction, and then they're like maybe taking a little bit of skin out below the belly button or something like that, which works for a select number of patients. But if your skin is lax above the belly button, that's not a great option for you, because it's just not going to provide you the tightening that you need. So my threshold for telling people they need a tummy tuck is pretty low.
Oh, okay. So once you get the tummy tuck, exactly what are you doing?
So with the tummy, as far as the procedure, so with the tummy tuck, and I apologize, y'all, I'm holding my ear. I have my headphone in. With the tummy tuck procedure, and sort of like what we talked about the facelift, what's great about a tummy tuck is it addresses multiple things. One, it addresses that loose skin that you can't address any other way. So it actually takes the loose skin out. 2, you're able to also address if there's any extra fat. So I can either directly cut the fat out, or I can do liposuction in conjunction with the tummy tuck to address that fat. The other thing about a tummy tuck that a lot of people don't realize, that's probably one of the more critical parts of a tummy tuck, is your rectus muscles, or your 6-pack muscles. When you're fit and you're in shape, they sit like this and they keep your stomach flat so that everything is just perfectly flat like this. With weight gain, age, pregnancy, or the like, your muscles may kind of start to splay a little bit like this and get more relaxed. And then even if you lose weight, they may contract back a little bit, but now you've kind of got this soft thing and it's kind of like this. And every time you sit up, if you don't suck in, your belly goes like this.
Mm-hmm.
And so that's what happens with most people. And in a tummy tuck, when we lift that flap of skin up, I can actually see if your muscles are spread apart. It's called a diastasis recti, or a rectus diastasis, however you want to refer to it. But if those muscles are spread apart, that's the same thing. You can't go to the gym. You can't exercise those muscles back together. So we physically will tighten those muscles and bring them back together so that these muscles are now back like this. So that now when you're in your normal posture, your stomach is flat, it kind of helps to restore your core strength because now your muscles are where they're supposed to be.
Mm-hmm.
And that's what gives you that flat contour and kind of gives you that corseted waistline in addition to the liposuction. So we're addressing skin, fat, and muscle when we do a tummy tuck.
Awesome.
And we do move your belly button. That's one thing a lot of people always ask. Do I have to move my belly button? We don't actually cut your belly button off. We just cut around it and then bring it back out once we pull all that skin out.
Awesome. So I have a question from our audience for you, Dr. Bolden.
Okay.
And the question is, what type of surgery is suggested for getting rid of a double chin?
Okay, so that's a good question as well. So it's going to depend again on your skin quality. So, you know, when you talk about a double chin, if it's just really full, but you've got really good skin quality that kind of snaps back, you know, I guess when we're talking about skin quality, the best analogy I can make is, you know, if you pull the skin on the back of your hand, if when you release it, it kind of stays crinkled before it relaxes back, that means that skin's lost its elasticity. So if you can pinch your skin and it snaps right back, then that's good elasticity. If you can't, you know, if you're pinching your chin skin and you do like this and it stays kind of crinkled for a while, then you've probably got pretty bad skin.
Let me try it.
Right. You probably got pretty bad skin quality, or at least or skin laxity. And if that's the case, you may, you know, depending on the severity of it, liposuction alone may not be an option. So if you've got a double chin, good skin quality, but it's just kind of like a fatty chin, liposuction may be a great option for you because it'll remove that fat. Your skin has good quality, and so it'll contract back and contour and give you that really nice neck contour that you're looking for. If you've got a fatty, you know, if you've got a little bit of fat and your skin's a little bit looser, then we may be able to do liposuction and add the radio frequency like we talked about earlier to provide that extra skin tightening that maybe you wouldn't do naturally on your own. If it's really, really loose though, then and it's kind of has that turkey neck appearance or that hanging, sometimes the only option is to really remove that skin and pull it from back here, and that would be a neck lift.
You said turkey neck, and it just I envisioned the turkey neck.
It is actually that, right? Turkey neck, okay.
I'm not the turkey neck yet, but
and the good thing about skin of color is most of us, even when our neck gets full, most of us have pretty good skin quality and can afford to at least do liposuction and some skin tightening techniques before we actually commit to neck lifts. In my practice, I find, you know, for my white patients, they may be coming to get a neck lift in their 50s. For most of my patients of color, we're maybe, you know, most of those patients that I'm doing facelifts are, it's typically definitely into their 60s, you know, late 60s before they're really asking. That's not a hard and fast rule, but I would say in general, that's kind of the trend that I see.
Okay.
Very informative. Very, very informative. So, dermatologist versus esthetician.
So I guess, you know, in my practice, it really depends on, well, there's certain things that you just have that are only, you know, your license will only allow you to do certain things. So for example, and actually the funny thing about being in the DMV is all three states are not the same, or at least in a state, you know what I mean? All three areas are not the same. So what, for example, say a nurse practitioner or a physician's assistant can do in DC versus Maryland versus Virginia is a little bit different. So you kind of have to know what you can do in that area. For the consumer, that's a hard thing to know because you aren't going to really have access to that information unless you're super resourceful. So my kind of the rule that I usually tell people is if you're doing something that's more invasive, you know, even including Botox and fillers, what I usually recommend is that your first consultation should probably be with the dermatologist or the plastic surgeon first, so that we can talk about what medical indications and things like that, or if you need a procedure that is going to be only in the hands of a licensed practitioner in that respect. But a lot of times you'll find that once you meet with the dermatologist, they'll say, hey, here's the thing that I think will work well, but let me let you go talk to my esthetician, because that's who's really going to give you the down and out and the dirty about, you know, what the skincare regimen is that they recommend, or do they recommend facials for you? Do they recommend peels? So I think it's not really an either or. I think you get the most benefit when you work in a comprehensive practice. And I'm going to go ahead and do the shameless plug just because I do, you know, that's my practice. But, you know, at a place like Cultura Dermatology and Plastic Surgery, it's really an ideal environment because my partner's a dermatologist. I'm a plastic surgeon. We've got nurse practitioners, nurses, and estheticians that all work under the same roof. And it's very, very complementary. So our nurses, you know, the nurses and the MDs are the ones that are doing the injectables because that's how we're licensed in DC. So that's the safe way to do it. But in every other respect, our estheticians are expert in lasers and complexion blending, laser hair removal, facials, and the whole nine. And really, it makes for a nice flow to the practice. They're great at skincare and everything. So I would try to caution people from saying they have to choose one over the other, but maybe more look for a practice where you're not having to wait for the dermatologist or the plastic surgeon schedule every time, because sometimes that can be a challenge too. And with skincare, just like they were talking about earlier, you really want to get on a schedule. You know, you want to make sure that you're getting in there and you're doing the things that you need to do. If you've purchased a laser practice, you know, you need to go every 6 weeks to do that therapy or whatever their recommendation is. And you don't want to miss a week just because you couldn't get in with the dermatologist or the plastic surgeon. So I think just having kind of a complement of practitioners that you can go to is really good.
Well, you just answered 2 questions in one.
I'm trying to listen.
So let me see. Where do we go with this? So
It was so informative that I just
I
had
know.
to sit back and go, wow. I mean, you've given us, you know, a lot of information as well as the viewers, and they're popping up like crazy saying thank you, thank you, thank you, because they appreciate, you know, I'm pretty sure a lot of things that they had no idea about, just like, you know, myself and Janice.
Yeah.
So
Well,
definitely
good.
good
I'm glad
info.
to hear. Good.
So if someone had to seek a dermatologist before they came to see a plastic surgeon, what advice would you have for them for seeking one?
So I would say, a couple things. One, it depends on what, you know, again, kind of to what extent you need your skincare. If, for example, and I guess, you know, I heard you guys talking earlier too about, you know, the financial aspect of it, because I do think that that's one thing that is hard to overcome. It takes people a while to want to invest in their skincare, because, you know, they look at the price tags on the products, they look at the price tags on the treatments, and they're kind of like, wow, do I really need to do that? So, the answer to that would be yes. It's sort of like going into a tattoo parlor. You know, you kind of pay you get what you pay for. You go into a tattoo parlor and it's cheap. You can expect that thing to bleed and to look like a big lump, you know, a big blob, you know, after a couple of years. So
Going to the house party.
Exactly. So you want to invest. But I would say if it's something where you're going to need a lot of like say acne, for example, you know, that may be that you want to find a dermatologist that does take insurance, because a lot of times that can be covered. So, you know, finding out whether what you're getting treatment for will be covered by your insurance, I think should be step number one, because financially that can be really helpful, you know, if you can get it covered. I would say a lot of the aesthetic aspect of skincare, though, is not covered by insurance. So if that's the case, then that kind of opens up even more people that you can explore. Just like with anything, again, looking at people's credentials, there's not a lot of people walking around saying that they're a dermatologist that aren't, because there's no other real, you know, I guess they could say they're a skincare doctor, but really dermatologist is if there's someone's calling themselves a dermatologist, then they really should be a board certified dermatologist. But you do want to ask those questions, or at least look them up. Nowadays, you can just type somebody's name in, unfortunately, and then get probably the name of all their kids and where their kids go to school and all that kind of stuff. So you should be able to find their board certification. But same thing, I think just seeing what kind of services they offer, because when it comes to skincare, it's not a one thing that works. It's really kind of doing the whole package. You know, you want to have that basic skincare regimen. What do you wash your face with? What kind of serums do you use? What moisturizer do you use? Do you need to do complexion blending with lasers? And if you're doing that, how often does that need to happen? How many lasers does that practice offer? Because once you start treating your skin with lasers, you know, the skin may be, if it's laser hair removal, if it's complexion blending, whatever it is that you're treating, one laser may not be what you need every time. As your skin starts to evolve and change, you may need a different type of laser. Laser hair removal is a perfect example. As that hair gets thinner and finer, the same laser that maybe you use when your hair was thick and coarse may not give you the same effectiveness once your hair starts to thin out a little bit. So I think also looking and making sure that they have a good armamentarium of lasers and just different modalities to treat your skin is going to be helpful.
Okay, good to know.
Very good, very good.
Wow. This has
Wow.
been so informational.
I mean, I'm just sitting here and I'm just listening. I'm just sitting here. I'm like, wow, you know.
It's a lot to take in, but it's things that I know a lot of our audience needed to know
Yeah.
Yes.
without going to Instagram or YouTube to find out.
Yeah.
Got it firsthand right here, live and in effect, right?
Exactly. So, Dr. Bolden,
Yes.
how can interested clients contact you?
Oh, and I hope that they will. So so there's a couple of things. I am on social media. So my Instagram is the Bolden Beautiful. So TheBolden Beautiful, all one word. So at the Bolden Beautiful. On Facebook as well. I think my Facebook I think you can find it under the Bolden Beautiful, but on Facebook it'll just say Dr. Kelly Bolden, Kelly. The Cultura website, which would also have our dermatology procedures and things like that, is culturamed.com. So CULTURAMED.com. And so that's where you would find that. And then our number, which is also fairly easy, is 202-237-9292. And you can call, during the day, set up appointments. Like I said, all of our consultations are complimentary. Even on the dermatology side, they'll actually do a complimentary skin analysis, put your face in a machine, what's called the Visia. They tell you what your trouble areas are, if you're oily, if you're dry, if you've got skin damage, and that's how they basically will develop your skincare regimen. So all of those things are complimentary when you come, and then we'll just tell you what we think, give our expert advice. So we would love for you to come see us as soon as you can.
Go see her.
Yes, I'm telling you, go check her out.
I don't even know if it gets better than this.
It's not. I mean, just listening to all of the tips and just all of the information that you've given alone in this segment was enough to say, if I had to go to someone, I'm going on Instagram at the Bolden Beautiful, and I'm going to go see Dr. Kelly. Because of just all of the information that you were able to give. So
thank you so much. Well, this is my favorite thing to do, and I do think that there's it's nice to be able to go to someone that looks like you. One, because I think you share some of the same experiences or some of the same concerns, and not to take away from other practitioners, because again, I know that I think there are people that are good at what they do that are every shade and color and ethnicity and culture, but there is something I think to be said about someone who's taking care of people that are, skin of color, because we have our own little nuances. You guys talked about PIH earlier, you talk about scarring. We didn't even go into like hypertrophic scars and keloids and all those kind of things. So I do think it's helpful just to have somebody who has that knowledge and that experience. So I appreciate you all having me on. I'm always happy to do these kind of things. So thank you.
Thank you.
Yes, thank you so much. I was looking forward to the baby. I thought the baby was going to have a couple of questions.
I know, he was getting real feisty. He started getting feisty. So you probably have heard him a couple of times here in the background. So
he was just letting you know he wanted to come in. He said, yeah. Oh, man.
Again, Dr. Kelly Bolden, we definitely appreciate you for doing
my pleasure.
Panel with us, discussion, and we really appreciate the knowledge that you've given us today. I hope everyone comes to see you, because if they have not learned yet, you know what you're talking about.
Yes, indeed.
Thank you so much. And I look forward to seeing people. Absolutely. And just so you guys know, we do virtual and in person. So even if you're not in the area, we can still see you. So we'd be happy to see you.
Well, thank you so much. Thank our viewers, because, we appreciate you guys chiming in with us today as well. And it's on you, Janice. I'm hungry.
Awesome. I had a great time.
I'm hungry. I need something to eat. Are you hungry?
No.
I haven't eaten dinner. I'm hungry.
No, I'm not hungry.
My
But
stomach growled a couple times. I was like, they can't hear it, can they? Make sure I mute it. You know, they don't.
what if I was hungry? I can actually tell you I was hungry for the information that I got tonight.
Man, that was
A
some.
lot of it. And
I'm
I had
talking
a great
about from the
time.
esthetician to the plastic surgeon, even the questions that a lot of the people from the audience were asking. You know, those were good questions that I don't even think I probably would have thought of at the time. So,
So
you know,
question, did you
thank
learn
you guys.
anything?
Did
Did
I?
you learn anything? Yes, you.
Yeah, I learned a lot. I was over here writing stuff down. You know, I was listening. I got the social media stuff. You know, see my paper? I was writing.
Well, again, it was wonderful to have you, Ebony. I really
Yes,
appreciate
thank
you
you.
coming on with me tonight. It was
My
wonderful to have
pleasure.
everybody in the audience to ask all the questions and actually be a part of the skincare panel tonight. And I
Indeed.
hope to see you all next time.
Hey, looking forward to our next segment.
Me too. Good
That's
night,
going to be
everybody.
interesting.
It really
Good
is.
night. Yeah.
Good night.